Proposals to encourage a healthy diet. Trinidad and Tobago health. I feel GVT must take the lead. Higher tax can nudge the nation the right way when sensibly applied. In due time health costs reduce from a healthy nation and lives saved. Read description or closed caption. 1. State institutions. Healthy eating at state institutions. Low fat, sugar, cholesterol, diabetic food and drink are only what permitted at ministries and other government institutions, extending to vending machines. Diet in Japan studied obesity is very low versus the USA. At the thousands of convenience stores, low-risk food and drink are sold plentifully and cheaply, compared to a much lower proportion of junk fast food locations existing in Japan. Gourmet hospital meals. Billions spent yearly in horrible food. Just like the school feeding program for school kids, food is to be high quality decided by dietitian and every patient's meal recorded digitally. Additionally, healthy packaged food like low-sugar yogurt and nuts can be added. Meals prepared by a trained chef. Freshly squeezed fruit and vegetable juice part of the menu. 2. General public. Healthy eating. Trinidad has a very high heart disease rate in the Western world. With government push, manufacturers are asked to produce snacks, drinks and other food with health in mind at reasonable cost. Active push to reduce all healthy food like fish, vegetable and fruit price. The cost of healthy food like fish and fruit are to drop by government measures like farming. Schools will directly benefit from the program, such replacing unhealthy snacks and the public actively encouraged to consume. Subsidize low and zero fat, cholesterol and sugar consumption, a preventative medicine measure, foods, drinks and snacks. Example. Chia, almond butter, sourdough bread, Splenda, versions of chocolate and ice cream, glucerna, whole wheat, so to healthy processed foods, or government subsidize 30% to help encourage good health, including foreign brands. Trinidad has very high heart disease rate. Government will examine making its own factory also, aimed at local and foreign sale. Soda and juice tax. A high tax, designed to reduce consumption of sweetened beverages. Drinks covered under a soda tax shall include carbonated soft drinks, sports drinks, high sugar juice and energy drinks. This policy intervention is an effort to decrease obesity and the health impacts related to being overweight. Unhealthy solid food tax. A high tax on solids of dangerously high content of preservatives, both sodium and salt, fat, cholesterol, oils, sugar. Certain processed meats and packaged foods as well, among them white bread, pork and ham. This policy intervention is an effort to decrease obesity and the health impacts related to being overweight. Note in tandem is increased availability of healthy foods like whole wheat and collaboration with manufacturers. Ban trans fats. Restaurants fry food in oil, raising health risk from consumed foodstuff. Business will be mandated to use healthy oil. Healthiness of processed food. Government will address potential effect or risk. Processed food with some exceptions are dietary risk to human health. 3. School. Healthy food and drink introduced mandatorily in school. Unhealthy ones banned. Manufacturers locally asked to make less sugary drinks and overall healthy food and snacks are encouraged, specifically low fat, sugar, cholesterol. Schools are to directly receive. Gourmet school lunches. Highest quality in restaurants given to kids and a dietitian set meals. The education ministry has 60 days to prepare a plan for implementation. Additionally, healthy packaged food like yogurt and nuts can be added. Food prepared by a trained chef as in France. Freshly squeezed fruit and vegetable juice part of the menu. School beverages offered mandatory unsweetened or 100% no added sugar drinks are offered to students. Regular juices, high in sugar, soft drink and the like banned. So it is for solid food.